Major depression. Starting off strong, we begin with major depression. Major depression is a mental health issue that comes with a persistent feeling of sadness or lack of interest in the outside world. People with major depression go through a roller coaster of different emotions. If you have major depression, you'd usually feel as grumpy as a cat's in the morning, have low self-worth, or even have trouble seeing anything positive. You might also feel restless, feel trouble with focusing, or get upset with the people you care about. Other symptoms include you wanting to be alone and sleep more, not wanting to live, or noticing changes in your weight. Major depression could be recurrent, which means people suffering may experience episodes once a month, once a year, or several times throughout their lives. Dysthymia. Lasting for 2 years or more, dysthymia may not be as intense as major depression, but it can still cause more or less the same problems as major depression. People with this type of depression are usually melancholic with low self-esteem, fluctuations in appetite, disrupted sleep patterns, and memory issues, unable to maintain interest in things they once liked. Manic depression. When you have manic depression, you have times when you feel super happy followed by episodes where you feel down. During a manic phase, one may experience high energy levels, less sleep, irritability, rapid thoughts and speech, boosted self-esteem and confidence, engaging in unusual or risky behavior, and euphoria. For a doctor to diagnose this disorder in you, he needs to check whether you've had a manic episode lasting at least 7 days or less. When you're in a depressive episode, you might feel really sad or empty, lack energy, get tired easily, have trouble sleeping, find it hard to concentrate, lose interest, and even have thoughts about hurting yourself. In severe cases, you may have hallucinations and delusions. Postpartum depression. Postpartum depression and crying comes right after having a baby. It is also called baby blues. This type of depression is completely normal and usually gets better in a week or two. Typically linked to hormonal changes after childbirth, about 1 in 7 women may go through something more intense than the usual baby blues. If a new mom continues to feel sad or worried for several weeks, she might have postpartum depression or PPD. PPD symptoms include feeling sad for weeks, pulling away from loved ones, not enjoying things, having changes in sleep and eating habits, feeling tired all the time, getting easily angry, and having racing thoughts. Seasonal affective disorder. Seasonal affective disorder is connected to the changing seasons. People with this depression experience symptoms at the start and at the end around the same time each year. Seasonal affective disorder can have a person feel tired, lose interest in things, heaviness in arms and legs, wanting to eat carbs and gaining weight, and facing problems in relationships. Psychotic depression. Approximately 20% of individuals with depression undergo severe episodes containing psychotic symptoms. If someone is diagnosed with major depressive disorder with psychotic features, it indicates a combination of depression symptoms and psychosis. Psychosis entails confused thoughts or behaviors, believing in falsehoods, or experiencing sensory perceptions that are not real. Early psychosis refers to the period when someone appears to be losing touch with reality. Signs of early psychosis include distrust of others, avoiding social interactions, experiencing intense and inappropriate emotions, struggling with clear thinking, neglecting personal hygiene, and facing difficulties in work or school. A diagnosis of psychotic depression requires a depressive episode lasting 2 weeks or more, accompanied by delusions and hallucinations. There are 2 subtypes, one with delusions and hallucinations related to depressive themes, and the other with content unrelated to depressive themes. Premenstrual dysphoric disorder. Premenstrual dysphoric disorder is a hormonal-linked issue occurring cyclically. It's considered a severe form of premenstrual syndrome, which many women experience. However, only about 5% of women are diagnosed with this disorder, despite around 85% experiencing premenstrual syndrome. Its primary symptoms revolve around feelings of depression and anxiety, accompanied by behavioral and physical signs. Diagnosis of PMDD requires experiencing these symptoms in most menstrual cycles over a year, and they should have impacted work or social life. To alleviate mood and anxiety symptoms of this disorder, doctors may recommend certain antidepressants. Atypical depression. Atypical depression is characterized by periods where mood improves temporarily after positive events. Your doctor might diagnose it as major depressive disorder with atypical features. Despite being labeled atypical, it's not uncommon and doesn't necessarily indicate a more or less serious form of depression. Coping with atypical depression can be challenging because you may not always exhibit or feel depressed. It can occur within episodes of major depression or persistent depression. Other indicators may include increased eating and weight gain, struggles with eating patterns, negative body image, excessive sleeping or insomnia, heaviness in limbs, feelings of rejection, sensitivity to criticism, and various physical discomforts. Situational depression. Situational depression, also known as adjustment disorder with depressed mood, seems similar to major depression, but it's triggered by specific events or situations like the death of a loved one, serious illness, divorce, abusive relationships, unemployment, or facing tough legal issues. Feeling sad, anxious, or pulling away from others during tough times is okay, but when these feelings become too big for the situation and mess with your daily life, that's situational depression. Symptoms usually begin within 3 months of the event and may include frequent crying, constant fear or worry, hopelessness, anxiety, appetite changes, difficulty in focusing, sleeping and carrying out tasks, and anger. Disruptive mood dysregulation disorder. DMDD is a psychiatric disorder characterized by severe and recurrent temper outbursts that are disproportionate to the situation and inconsistent with the individual's developmental level. These outbursts occur frequently and are present for at least 12 months. Children and adolescents with DMDD often experience irritability or anger most of the day, nearly every day. Cyclothymic disorder. Cyclothymic disorder is a mood disorder characterized by chronic fluctuations in mood that alternate between hypomania or elevated mood and mild depression. These mood swings are less severe than those seen in bipolar disorder, but are chronic and persistent. Individuals with cyclothymic disorder may experience periods of increased energy, racing thoughts, and impulsivity during hypomanic episodes, while depressive episodes involve sadness, fatigue, and low self-esteem. Melancholia. Melancholia is a severe form of depression characterized by profound and persistent feelings of sadness, emptiness, and hopelessness. Individuals with melancholic depression often experience a loss of interest or pleasure in activities they once enjoyed, along with changes in appetite, sleep disturbances, and significant weight loss or gain. They may also exhibit psychomotor agitation or retardation, fatigue, and feelings of worthlessness or excessive guilt. Treatment-resistant depression. Treatment-resistant depression (TRD) is a form of major depressive disorder that does not respond adequately to standard antidepressant medications or psychotherapy. Individuals with TRD may fail to achieve remission of symptoms despite trying multiple treatments. TRD can be challenging to manage and may require alternative treatment strategies, such as augmentation with additional medications, electroconvulsive therapy, or other neuromodulation techniques. Substance-induced depressive disorder. Substance-induced depressive disorder is triggered by the use or withdrawal of substances such as alcohol, drugs, or medications. Depressive symptoms may develop as a direct result of the substance's effects on brain chemistry or as a reaction to the consequences of substance abuse. Subsyndromal depression. Subsyndromal depression, often termed minor depression, refers to a condition where individuals experience depressive symptoms that fall short of meeting the full diagnostic criteria for major depressive disorder (MDD), yet still significantly impact daily functioning and well-being. These symptoms, which may include persistent sadness, loss of interest, changes in appetite or sleep patterns, and feelings of worthlessness, persist for at least 2 weeks but do not reach the severity or duration required for a formal diagnosis of MDD. Despite their subtlety, subsyndromal depressive symptoms can lead to impairment in various areas of life and may benefit from therapeutic intervention to prevent further deterioration in mental health.